Have you ever felt a mysterious force that creeps out of the brain's corridors, wipes out familiar faces, and steals precious moments one has enjoyed with his loved ones? Alzheimer's disease is an illness that turns friends and family into strangers. Alzheimer's is an insidious invader that makes it difficult for people to identify their surroundings. It is a confusing puzzle that leaves many questions about one's identity. Let's move on to unravel the mysteries of Alzheimer's disease and how it slowly progresses and makes someone's life gloomy. What is Alzheimer's disease? Alzheimer's disease, abbreviated as AD, was named after a German neuropathologist, Alois Alzheimer, in 1906. AD is a brain disorder, particularly of the cerebral cortex in our brain. The cerebral cortex is the part of the brain that controls memory, problem-solving skills, emotions, learning, and consciousness. Our brain comprises numerous building blocks called neurons or nerve cells. AD is characterized by degeneration of nerve cells and loss of neural connections in the cerebral cortex, eventually leading to various mental problems, including loss of thinking skills and memory. AD influences cognitive abilities like reading, learning, thinking, speaking, problem-solving, and concentrating. AD makes it difficult for a person to perform typical day-to-day tasks. Dr. Alzheimer microscopically observed the damaged brain tissues of a woman whose death was caused by an uncommon mental condition. However, he was aware of the significant symptoms of that woman, and symptoms include memory loss, trouble speaking, and unusual behavior. He observed very rare plaques and tangled bundles of nerve cells and nerve fibers in the dead woman's brain tissues. These plaques are known as amyloid plaques, while tangled bundles are called neurofibrillary tangles. These tangles and plaques are unique features of Alzheimer's disease. Therefore, degeneration of neurons and loss of nerve connections disrupt the transmission of signals among neurons and other body parts. Consequently, it results in the loss of various cognitive abilities, finally leading to dementia. The neural degeneration caused by AD is irreversible. According to reports, approximately 24 million people have Alzheimer's disease, and it is predicted to rise by 75.6 million by 2030. What are the reasons behind Alzheimer's disease? Amyloid plaques and neurofibrillary tangles are the leading cause of AD. Reports from neuropathology revealed clumps of amyloid beta protein and tangles of tau protein in the brain tissues as the main reason for AD. Amyloid beta and tau proteins are usually found in nerve cells. However, whenever these proteins are incomplete and improperly processed, they bunch together and gather in nerve cells, causing them to degenerate and shut down. Reduced production of neurotransmitters like acetylcholine and transthyretin protein are also the reported cause of AD. Acetylcholine maintains communication among nerve cells, while transthyretin pumps amyloid beta protein out of the cell. Therefore, their decreased levels are also associated with AD. Hyperinsulinemia is also another cause of AD. Like other cells of the body, the brain cells are also dependent on glucose for functioning. Insulin binds to insulin receptors on neurons and allows glucose to enter nerve cells. But sometimes, the insulin cannot bind with nerve cells due to poor signaling. The insulin then starts to bulk up in the blood, causing hyperinsulinemia. This unusual insulin buildup in the blood causes nerve cells to be deprived of insulin. Therefore, nerve cells die off, and this whole scenario leads to AD. There are also genetic causes of AD, which makes AD a heritable disease. The chances of having AD increase by 10 to 30% if someone has a biological parent or sibling with AD. There is an APP gene that produces amyloid beta protein. A slight mutation in the APP gene causes overproduction of amyloid beta protein, eventually causing the clumps of amyloid protein in nerve cells. Similarly, there is another gene, a POE, which produces apolipoprotein E. This gene has three types: APEA2, APEA3, and APEA4. Acquiring defective APEO PE3 or a PEO4 gene, is associated with developing a D. What are the stages and symptoms of Alzheimer's disease? The symptoms usually appear at age 65 or older than 65. There are 3 stages of a D. The preclinical Alzheimer's disease, the mild cognitive impairment, MCI, due to Alzheimer's disease, the Alzheimer's dementia. What is preclinical Alzheimer's disease and its symptoms? It is the mild stage with no symptoms or few of the symptoms. Patients can go asymptomatic for years, but some changes are happening behind the scenes in their brains. It is usually challenging to diagnose a D at this stage. What is mild cognitive impairment, I due to Alzheimer's disease and its symptoms? This stage consists of more apparent symptoms. Patients with a D fail to recall recently learned things, places, names, and events. Patients also face difficulty in appropriately expressing their emotions. Patients with a D quickly lose or misplace anything and take time to do daily chores. They also find it troublesome to make plans and logically solve any problem. Irritability, sleep disturbances, and delusions regarding family and friends are the symptoms that are common during this stage. What is Alzheimer's dementia and its symptoms? This is the severe stage of Alzheimer's disease, and it becomes essential to take proper care of patients. The common symptoms include total loss of memory. Their ability to communicate is completely deteriorated, and they are unable to speak correctly as they do not remember most of the words. People with a D at a severe stage become susceptible to many illnesses like pneumonia and skin infections. How Alzheimer's disease can be diagnosed. The healthcare provider asks about overall health, recent medications, history, and mood swings to identify whether the patient has a D or another neurological disease. The doctor asks the patient to do regular daily chores and observes whether the patient can do them. Then, other tests may also be done to confirm a D in people, such as neurological tests and blood tests, to screen patients for different illnesses. The doctor also asks to do simple math that requires problem-solving skills. Besides this, a CT scan, brain MRI, or positron emission tomography is also used to detect changes in the brain's nerve cells and tissues. How Alzheimer's disease can be treated. The damage caused by a D is irreversible, but the U.S. Food and Drug Administration has permitted 2 drugs that help decelerate the symptoms. Choline esterase inhibitors and NMDA antagonists are the drugs that have been reported to slow down the progression of a D. Choline esterase inhibitors help treat mild to moderate a D. These drugs block the enzyme that degenerates acetylcholine, as a D patients already have less acetylcholine. Hence, these drugs try to retain available acetylcholine for better communication among nerve cells. It is important to note that these drugs only slow down the progression of a D, rather than stopping it or completely curing it. NMDA antagonists help treat moderate to severe Alzheimer's disease. It keeps brain cells functioning and healthy. How Alzheimer's disease can be managed. People with a D require exceptional support and care from their loved ones. As they cannot do routine chores and tend to forget easily, it is necessary to keep a friendly and accustomed environment for them. Try not to move things that they have placed. Always make them comfortable with their favorite things, such as a soft plushie or blanket. Always attempt to make them happy if you feel something is bothering them. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.